Dr. Can you hear me? Dr. Natalie Erlich-Malona. She is from UMass Memorial Health, and she'll be presenting tonight about the connection between Mozart and epilepsy and understanding that there is a connection between the two and how sometimes it can help sometimes with seizure control. Or how that helps. So she's going to explain that whole connection tonight and kind of the information about it and the research. A little bit of background about her. She has a clinical interest in music with epilepsy. Her education was at Tufts University School of Medicine in 2018. She did her residency program at Brown University, Rhode Island Hospital. And she also did her fellowship program at Brown University, Rhode Island Hospital and University of Massachusetts Medical School in 2002. So we're very, very happy to have her with us tonight, volunteering her time. I just want to remind everybody that every Wednesday, we are joined by these amazing doctors, and every Wednesday, they volunteer their time to be here with us. They're not getting paid. This is completely voluntary. So we're very, very happy to have her with us. A little bit of house cleaning tips. If you can make sure that if you have questions, put them in the chat. Make sure that you're muted during it. We will at the end have questions and answers. So you're more than welcome to hold your question till the end and you can actually ask it yourself. Or if you feel more comfortable just writing it in the chat, Amy or I will go ahead and ask the question for you. But we are very happy to be here tonight, and I'm going to turn the mic over to Dr. Natalie Erlich-Malona.
All right, thank you very much, Christine. Can everybody hear me?
Yes.
All right, so I'm gonna share my screen. Let's hope this works. Put this on slideshow. Okay, does everyone see my slides?
Yes.
Okay, perfect. So hi, everyone. My name is Natalie Erlich-Malona. As Christine mentioned, I'm an epileptologist at UMass Memorial Medical Center and assistant professor of neurology at UMass Chan Medical School. And I'm going to talk about the Mozart effect in epilepsy. A little bit more about me. You might say I'm uniquely qualified to give this talk because before pursuing a career in medicine, I was actually a professional pianist. I trained at the Juilliard School and the New England Conservatory of Music. And so I actually transitioned from spending my days reading sheet music like this to spending much of my time reading EEGs. Not an entirely different activity, as it turns out. A little bit about EEGs. So those of you who have epilepsy have all probably had at least one of these at some point. It's a test where electrodes are placed on the scalp, about 20 of them, and connected to a machine that produces the electroencephalogram, which is what we read, showing the electrical activity in the brain. And much like in music, the vertical lines denote an amount of time, in this case, a second. And so each page shows us 15 seconds of brain activity. And the EEG usually lasts anywhere from 20 minutes to 24 hours, or sometimes even several days. So in the typical case where a patient somebody has had a seizure for the first time, or maybe more than one seizure, and we are performing an EEG, we want to find out if the person has epilepsy. What we're looking for is not seizures on the EEG, but we're looking for these interictal epileptiform discharges, which are like clues. So they are something that disturbs the background, tends to have a spiky morphology and an aftergoing slow wave. There are 6 criteria that we follow to designate these IEDs. And if we see even one of these on an EEG in a person who has had at least one clinical seizure, this will often be enough to make the diagnosis of epilepsy. Because it means that the person has a greater than 60% chance of having more seizures. So in some EEGs, we see many of these discharges. They might be abundant, like this one on the left. And And that might mean that this person has a higher risk of having a seizure sometime in the near future. And if the discharges are happening rhythmically or periodically at a frequency of 2.5 or more times per second for at least 10 seconds, that actually meets criteria for an electrographic seizure. So seizure is broadly defined as a sudden temporary burst of electrical activity in the brain that changes or disrupts the way messages are sent between brain cells. These electrical bursts may cause involuntary changes in body movement or function, sensation, behavior, or awareness. And music is broadly defined as vocal, instrumental, or mechanical sounds having rhythm, melody, or harmony, or the science or art of ordering tones or sounds in succession, in combination, and in temporal relationships to produce a composition having unity and continuity. The word ictus, I really like this, which in prosody means the recurring stress or beat in a rhythmic or metrical series of sounds, is used in both music and medicine. In music, it means the indication of a musical event, most often the beat of the tempo or the entry of a section of the orchestra. And in medicine, actually means a seizure. So in my work, we talk about the ictal semiology, means what does the seizure actually look like clinically when we see the patient having a seizure. And we might also talk about the ictal findings on the EEG versus the interictal discharges, like I mentioned, meaning between seizures. So the first person to explore using Mozart to treat neurological diseases was the French otolaryngologist and inventor Alfred Tomatis, who in 1991 published this book, Pourquoi Mozart, explaining his use of Mozart to treat learning disabilities, psychiatric disorders, and autism. In the book, he described numerous experiments he had performed on his patients over 25 years. And the Tomatis method, a type of auditory integration training, is still mentioned in many papers even today, but it's largely classified as a pseudoscience. The paper that started the avalanche of research into the purported effects of Mozart on the brain was this small study in 1993 by Francis Rauscher, in which 36 college students were given an IQ test under 3 different listening conditions: the Mozart Sonata, Herschel 448 for 2 pianos, a relaxation tape consisting of spoken words in a monotone voice, and silence, and found that the group that listened to Mozart performed significantly better on the spatial reasoning tests. This was an effect that lasted for 10 minutes. This finding was taken up by the Associated Press and was big news all over the news. Frances Rauscher described in interviews how the reporters were banging down her door, and she was on nightly news with Tom Brokaw. Well, we're very excited. So I want to play a little bit of this piece that was used both in this study and in most of the studies that I'll be talking about. So I'll just play a little bit of it for you.
And Dr. Erlich-Malona,
Yes.
just make sure you share your sound.
Oh, I'm just playing it from my phone.
Oh, perfect.
Can you hear it?
No, you have to share your sound on your Zoom or else it won't play any, like it's weird like that.
Wait, have you've been hearing me talk though?
Yeah, but we can't hear the music. Hold on. Play it maybe close. I don't know if it's the speakers, like the speakers on your computer. I don't know why it doesn't. I don't know the sound.
Oh, that is really strange.
Try it again. Try it again. Maybe it just wasn't close enough.
Okay.
I still can't. Amy, can you hear it at all? No, I
No,
can't.
okay. Sorry about that.
No, that's okay. I just
Well,
was
you can all look it up and listen to it. I'm not gonna play with it anymore now. Sorry about that. Next time I'll have it on the computer. So in any case, Francis Rauscher went on to perform more studies, one comparing Mozart to Philip Glass and trance music, in which the latter two did not have a similar effect, and one in which rats who were exposed both in utero and for 60 days postpartum to the Mozart sonata performed better on mazes for 5 days than their control counterparts. If you were around in the 90s, you may remember seeing displays like this in your local Barnes & Noble or Virgin Records. Everyone was very excited at the idea that listening to Mozart could make you instantly smarter. Further studies were performed with rodents, including this one with mice, in which they were exposed for 10 hours a day to either the Mozart 448 or Beethoven's Für Elise. And they went through mazes 15 times. And as you can see, the Mozart group went through the mazes more quickly than the Beethoven group, and they actually improved in their time over the 15 trials. They also made fewer errors than the Beethoven group and also improved to a greater degree in terms of errors than the Beethoven group. The first study looking at the EEG effects of Mozart and spatial temporal reasoning was this one in 1997, in which, similar to the original study, 7 subjects performed spatial temporal reasoning tasks, both with the Mozart sonata and without. And the major finding, as unfortunately you cannot see from this poor quality photocopy, was that whereas people normally have activation of their right temporoparietal cortex when performing spatial temporal reasoning tasks, with Mozart and some of the patients there was, or some of the subjects, there was the addition of left temporoparietal cortex activation and an increase in prefrontal cortex EEG coherence. They also saw enhanced cooperativity between different prefrontal sites and possibly increased cortical efficacy. So the authors talked about other studies that have been done on task performance, whether it be playing video games or playing a sport or a musical instrument, looking at people's brains. Those who have more experience have decreased brain activation, as if the brain is basically more efficient at performing those tasks. So they hypothesized that maybe listening to Mozart was a sort of shortcut to that effect. The first study looking at Mozart in epilepsy was by John Hughes in 1998, in which he took 29 conscious and unconscious patients with a high baseline frequency of interictal discharges and exposed them to Mozart. And 23 of them, whether awake or even in comatose states, had a significant reduction in epileptiform activity, including patients in the midst of status epilepticus. You can see in these graphs, the top one's looking at amplitude and the bottom one is looking at frequency of discharges. And during the Mozart exposure, there was a decrease in both of those metrics. And he did compare this to old-time pop piano tunes and Philip Glass's music with changing parts, and did not see the same effect in those. So then more researchers were curious to look at this, and some randomized controlled trials were performed. This one only had 4 patients with a benign epilepsy with centrotemporal spikes, previously known as benign Rolandic epilepsy in children. And 2 out of the 4 of them with Mozart had greater than a 25% reduction in interictal discharges from baseline when exposed to 18 minutes of the Mozart 448, but not Beethoven's Für Elise. The other 2 patients had insufficient discharges to analyze. Then another study took 58 children with epilepsy and compared their EEG before, during, and after 8 minutes of the Mozart 448. And again, they found a reduction in IEDs with the original sonata, but not a computerized string version. So they hypothesized that it was something about the lower harmonics or more fundamental tones in the original. But as a musician, I have to wonder if it might be because it was a computerized string version. And, I don't know what would happen if it was actual humans playing actual string instruments. There might have been more of an effect. Then another study looking at whether there was a more long-term effect. So they took 18 patients listening to the Mozart Sonata for 8 minutes every day, once daily before bedtime, and staying on the same medication for 6 months. And they found a significant decrease in discharge frequency at all time points, except for those with occipital discharges. Then another study thought, and too bad it's not working with playing you the music, but they said, well, how about the most popular Mozart sonata in C major that everyone knows, Kochel 545? Let's see if that one has an effect. And sure enough, it had a similar effect. They did notice the effect was seen for central and generalized discharges, but not for frontal or occipital discharges. Finally, in 2021 at Dartmouth, they did a study on 16 patients undergoing intracranial monitoring for refractory epilepsy, and they gave them 90 seconds of exposure to each Mozart and Wagner, and they found a significant reduction in interictal discharges only with Mozart, only after greater than 30 seconds, and only in bilateral frontal regions. The reduction in IEDs was seen both inside and outside of the seizure onset zone, but there was no temporal carryover effect. So possibly not a long enough exposure. We'll get back to that later. So Mozart's music might reduce interictal epileptiform discharges, but can it reduce seizure frequency was the next question. So first we have a case report of a 56-year-old man with a hypothalamic hamartoma who had lifelong gelastic seizures at a frequency of 5 or 6 per day, every day, consisting of intense laughter in association with altered perception and experiential phenomena, secondary generalized tonic-clonic seizures about 7 times a month, and memory impairment. He heard about the Mozart effect for spatiotemporal reasoning and decided to try it and see what happens. So he listened to various Mozart compositions for an average of 45 minutes per day. And during the 3 months of music therapy, his seizures became smaller. He had no altered perception, no experiential phenomena, no generalized tonic-clonic seizures. And instead of the intense laughter, he just had a small smile. That was it. So then a randomized controlled trial was performed on 25 patients with neurological disabilities and epilepsy and 11 control subjects. This was a 3-year study where the first year was just observational to establish a baseline seizure frequency. Then in the second year, the patients had Mozart, the 448, same sonata. They were exposed to it during sleep, so you can't really say they were listening to it, but it was playing for them during sleep, on and off throughout the night, as you can see below. So on 8.5 minutes, then off 8.5 minutes, and on and off throughout the night, every night for a year. And then in the third year, just a follow-up without Mozart. The control group didn't have any music. And as you can see, the control group actually had an increase in seizure frequency from year to year over the 3 years, whereas the treatment group had a decrease in seizure frequency in the second year that persisted in the third year, even when they were no longer having the music exposure. Then another study in children with drug-refractory epileptic encephalopathies. This was a randomized controlled trial of 19 patients where 9 of them were randomized to listen to the Sonata 448 2 hours a day for 2 weeks, and the other 10 children were randomized on a set of various compositions by Mozart for 2 hours a day. And there was a reduction in seizure frequency in many of the patients, and there was possibly even a greater effect. Not sure this was statistically significant, but a greater effect in the set of various Mozart compositions. So certainly not limited to that one particular piece. Then another study, 13 patients with refractory epilepsy. They had 3 months of listening to the Sonata 448 every day and 3 months of listening to a phase scrambled version, which was the same notes, but without the rhythmicity. And they found a significant decrease in seizure count during treatment, but not during the control period of the phase scrambled version. And high compliance rates were noted in this study. So there are many hypotheses that have been suggested for this surprising Mozart effect. Nobody knows for sure. It might be parasympathetic activation, so the body sort of causing a relaxation effect in the body. Could be enhanced dopaminergic transmission, so an increase in dopamine in the brain. Could be mirror neurons mediating neuronal activity by linking auditory stimulation directly to the motor cortex. People have brought up the optimized fundamental tones and minimized higher frequency harmonics, as I mentioned before. There's a theory that because Mozart started composing music at the age of 4, in a sort of divine sort of way, his music exploits the inherent spatial temporal firing patterns of the cortex, and hence his music resonates cortical structure. People have said perhaps the long-term periodicity found in Mozart's music reflects aspects of our brain and bodily function. And finally, other studies have shown that cognitive tasks recruiting motor pathways were more epileptogenic. And the thought is that, as we've seen, Mozart's music seems to activate spatial cognitive processes. So maybe those are inhibiting the neighboring motor areas and thereby dampening activity in those areas and dampening seizure activity. 3 meta-analyses have been performed over the years looking at the Mozart effect in epilepsy in 2014, 2020, and just last year. Each one dealt with a similar number of studies from 8 to 12, similar number of patients between 200 and 330. The first one concluded that listening to Mozart's music is associated with a reduction in intraictal discharges during and after exposure. The second one concluded that there's a significant reduction in intraictal discharges and seizure frequency after long-term music therapy, and in intraictal discharges after even a single exposure. But the third one concluded that there's no meaningful support for a beneficial effect of listening to Mozart's Sonata 448 on any medically relevant conditions, let alone a specific Mozart effect in epilepsy. And up here is a quote from that study. They said, "Unfounded authority, underpowered studies, and non-transparent reporting appeared to be the main drivers of the Mozart effect myth." So they sounded a little bit biased, but in any case, those were the findings. So the jury's still out. One of my colleagues at UMass, Pega Afra, when she was at Utah, they did a survey-based study thinking about the idea of basically an iPhone app playing Mozart's music for patients with epilepsy. So when they asked patients if they might be interested in such an app, 75% of patients said they would be interested in an app that played relaxing music that may help seizure control. And when asked how long they can imagine themselves using such an app for 10 minutes per day, 45% of patients said they could imagine using it for 1 year or longer. So very promising. So in conclusion, Mozart's Piano Sonata K448 may have an anti-epileptic effect. The mechanism mediating this effect is unknown. Music therapy is a low risk and low effort add-on therapy, and patient compliance is promising. And finally, the sonata used in these studies, K448, is only one of over 600 compositions by Mozart. You know, he wrote 20 operas, 20-something piano sonatas, 5 violin concertos, 27 piano concertos, 30-something string quartets, 18 masses, including the Requiem Mass. I could go on and on. It totals about 240 hours of music. So if you think about it, if you listen to even 2 hours a day of Mozart's music every day, you would only hear each piece 3 times in a year. So I tell my patients about the Mozart effect, but I don't really believe it's limited to just that one sonata. And I do suggest listening to lots of different music by Mozart. I have a feeling that it all might have that effect. So with that, I'll take questions.
We have one question that came up. It said, Dr. Malona, do you use Mozart in your treatment of patients with epilepsy at UMass or in combination with AEDs?
So I do talk about it with some of my patients. You know, it's not something that I talk about with every patient. I mean, a lot of patients are well controlled with medication alone. But I do have some patients who have tried Mozart, have told me that they have noticed a beneficial effect. And so I'll usually suggest like a few more particular pieces at each appointment.
Thank you.
Oh, let me see.
Another question came in. How long per treatment would you suggest patients listen to Mozart and what frequency?
So, you know, it's when talking about real life things like this, you know, you can't expect people to be compliant every single day. And so I'm not very specific about it, but you know, maybe I should be. But I do tell people to try listening as often as they can, to make it a routine in the evening before bedtime, as was done in many of these studies. And as far as how long, I would say at least 10 minutes, but longer, I would suspect that longer might have more of an effect. But you know, the data that I've presented, that's pretty much what's out there. So you can see each study kind of had different protocols. Some of them were playing music all through the night while people slept. So that is something people could try. Other ones just had 8 minutes at bedtime, and various other things were done.
I had to go off camera for a minute, so I might have missed this, but were the decrease in seizure activity only while they were listening to the Mozart, or did it have an effect after for a certain period of time?
So there were studies that showed that it had an effect after. There was one in particular that was the 3-year study, this one, where for a year, these people had it playing on and off throughout the night every night. And they had a decrease in seizure frequency that persisted even for the next year while they were no longer listening to the music or exposed to the music while they slept.
Great question, Amy. We also have two other questions that came in from Laura Wilson. How long per treatment would you suggest? Oh, we already did that one, sorry.
Yeah.
From Beth, does Mozart cause dizziness, headache, or more side effects?
There is no evidence of that. There's no reason to think that it would cause dizziness or any other side effects, since it's not a medication. You know, medication is designed to hit a target, but it always, all medications unintentionally hit some other targets, which causes side effects, more so in some patients than others. But music is not like that, so I would not expect any negative side effects.
And then another question was, are there some Mozart pieces better for sleep time than others with a more upbeat?
Oh, sure, but as I said, there are over 600 different compositions. So the majority of his music is in a major key, so that's considered more upbeat, although it won't be upbeat from beginning to end. My favorite pieces personally tend to be the ones in a minor key, and I don't think there's any reason to think that those would have less of a beneficial effect. So I wouldn't recommend the more upbeat ones over the less quote unquote upbeat ones. And, you know, personally, I think that it's the sort of form and structure of Mozart's music that probably has the most to do with the effect. As a musician, it was funny to me to read these studies and see how scientists would try to sort of isolate one variable by comparing this music to some other music. And they would focus on one thing when really, I mean, I could list 100 things that are different between the two types of music. So I think most, if not all of Mozart's music has that sort of form that you see in all of classical era music, you know, from the 18th into the early 19th century. And I think it has something to do with that. I mean, that's my hypothesis. And Mozart just did it better than anyone else.
We have
Oh,
another
I see this
Did you-
question,
okay, good.
that it might interrupt deep sleep. Yeah, I personally would worry about that as well. I mean, it's something that you could try, but I would worry about that because we definitely don't want to disturb sleep of anyone with epilepsy, since sleep deprivation is one of the three biggest triggers for breakthrough seizures in patients. So I would more recommend that people actually listen to the music while awake, but not play it while they're asleep.
That was a great question.
I have another question. Out of your patients that do use this as treatment, what has their reporting been? Like, what is their success?
So one of my patients said that she actually had a seizure stop by playing Mozart's music, and that her roommate witnessed it. She reported back to me. And she's been listening to a lot of Mozart, as well as some other music that she just likes. So she's made a routine of listening to music, including a lot of Mozart. And I mean, you know, it's hard in one person because we've been adjusting her medications. So it's hard to say definitively that the music has had an effect. But it's part of what we're doing to try to achieve the goal of seizure freedom that I have for all of my patients.
Um, Dr. Erlich-Malona, would you be able to share your slides with us as well? you be willing? to-
Yeah, sure.
Okay, awesome. I can send those out to everybody after we're done with the recording, and can definitely do that for everybody because I know that that's always a question: is are the slides going to be available for those to kind of follow on, especially for those that have not couldn't make it tonight. They like to see the slides in front of them as well. So thank you so much for that. I appreciate it.
Sure.
Are there any other questions for tonight? Wonderful. I want to say thank you again for joining us, Dr. Erlich-Malona. I want to say thank you for volunteering your time with us as well and being with us and presenting this. Again, if you had a chance to see this at the UMass conference, this is kind of the second go round because it was very well attended and a lot of people enjoyed the information, just kind of something different that maybe haven't thought of or tried to help. So thank you so much for presenting tonight. We so appreciate you being here tonight with us. I will let you know that next week, if you have not looked at the webinar list for next week, I can let you know that we're in November, that the next one is going to be on November 20th, and it's with transitioning services from youth to adult services. So we're talking about services through the state, through programs. So talking about disability, all those kind of pieces. So going from pediatric to adult services. So your child turns 18. Now what do I do? And what can I help in all those services that are there? And the Boston, the organization that'll be joining us next week will be the Boston Center for Independent Living. So I will also send out information about that. And if you haven't checked out the rest of our webinars are on events page, please do that. But we are so happy to have everybody here tonight and want to thank you again for joining us. Dr. Erlich-Malona, we're very, very lucky to have you here tonight. And thank you again for volunteering your time.
Thank you. Thank you all for coming.
Thank you so much. Well, everybody
Thank you.
All right. Bye-bye.